Okay, I apologize. I've sat here so long I had to turn my light on in the car. So, hallelujah. I hope that didn't take away from this beautiful picture. But anyway, so these may seem like very small, insignificant things. But I'm telling you, had it not been for the knowledge that I had as a nurse, going into the hospital setting, and after this clip that I publicized, I am going to post something that a nurse wrote that will verify some of what I'm going to go over. So the best thing you can do is educate yourself before you send a loved one into the hospital. And some of the reasons you would want to go into the hospital: number one, if you're not getting enough oxygen, well, how can you tell? Sometimes color will tell you, you know, of the individual. But the best thing you can do is get an incentive spirometer. They're very inexpensive, and you can get them at Walgreens and you know, different places. But in the repost I am going to do, and as I said again, she is going to verify that what I'm telling you is true indeed. So this is just an incentive spirometer, or not an incentive spirometer, a pulse ox, I apologize, that I purchased. I think it was, I don't know, maybe $37, but they're very easy. You just turn it on, put your finger in, and it's going to read your how much oxygen is in your blood, and also your heart rate. So and it doesn't take but a minute to pick up on those two numbers, excuse me. So right now I'm 79 pulse and I think 95 for my oxygen. So it picks it up pretty fast. You would not want this number, your oxygen saturation, to go below 90. You know, if you go to the doctor and you're below 90, they're going to put oxygen on you. So inexpensive, and something you should have in your home. If there's an altered state of mind, this could be another symptom that they're not getting enough oxygen. Now, when they get to altered state of mind, it's time to go to be seen, to be checked out. Okay, so obviously, if you're coughing up blood, it's time to go to the emergency room. Your urine being very dark, you're not getting enough fluids. So sometimes you just don't feel good enough to, you know, hydrate yourself. This is time for you to go to the emergency room. And again, these may seem fairly insignificant, but they do play a big role. When I got to the hospital, and this is why I am doing this video. After being in there a couple of days, and I truly, because of my oxygen saturation, I was sitting at 69 at one point, which is extremely low, was in intensive care, and I don't know where I went from there. I honestly don't. But I was just shy of being intubated. I put a post on Facebook, which caused some concerns. But at that point, the floor that I came from, there was a lot of these very small protocols that were not being addressed. And when I am laying there in a hospital bed, and I am seeing these things, even though, I'm not clearly thinking. I decided, if you do not start doing some things on your own, you're going to be in some statistics you don't want to be in. So one of the things that I did, and this sounds silly, but I knew that I needed exercise, and I just didn't have the energy. And I would hit the button to raise the bed all the way up, and then I'd hit the button again to lower it all the way down. I would do that like 10 times, and then I'd lay on my side. So I was trying to do things because I was too weak, and there was not visitation in my room, and I'm sure staff was busy. So when you have someone, especially elder, if you have someone that is in the hospital, it would, I don't know if you would be able to call them every couple of hours and explain to them, you need to roll over on your left side, and then a couple hours later, roll over on your right side, do a few leg lifts. They don't have to lift them all the way up in the air if they'll just, lift them up and just get some movement. Bring their knees in and lay them back down. They've got to do something. You just can't lay there. And again, even without the word COVID in front of pneumonia, these are nursing measures that we should be doing. But what happens is, because of all the putting on of the gown and, all the things that they have to wear to come in and take care of COVID patients, there were times that they would announce on the floor, breakfast trays are being served. So that might be 8 o'clock, for instance. Well, until your nurse is ready to do your care, your food is not only sitting out there in styrofoam, because they're not allowed to give you, regular plates. It has to be stuff they can throw away. So your breakfast or lunch or whatever is sitting out there until your nurse serves everybody else she's assigned to. And when they come in, you don't get to eat. They lay it aside, and they're going to do your IVs. They're going to check all your, do your full assessment or your evaluation. They're going to give you all your medication, and they're going to ask you, do you want anything? Do you need anything? And they yell out, to someone in the hallway. And if you need a cup of coffee or a cup of ice, they're going to have somebody bring it to the door. And for the most part, you're not going to see that nurse again until the next meal is being served. So the nurse essentially is everything to that patient. So because of that, you don't have someone coming in every 2 hours and saying, look, you need to roll over. Look, you need to, do a few leg lifts, or, every hour you need to be hitting that incentive spirometer, okay, to do your deep breathing, all right? Or you need to be taking in those 10 deep breaths. Every hour you should do that. So even without the word COVID in front of pneumonia, if you're in the hospital 2 or 3 days and you do not do these simple measures, without the virus, without anything, you can get pneumonia. So you see how easily this pneumonia can set in, because when, and I'm just speaking on my personal experience here, but I came home from work on a Friday and I just felt drug out. I just thought, you know, this has been a crazy week. We deal with COVID all day long. And I laid down. I almost couldn't wait to get home to lay down to take a nap. So when I woke up, it was 3 hours later. And when I woke up, I grabbed the thermometer. My temperature was 100. I said, you've got COVID. Because it was overtaking me, the viral. I could feel it. And so Friday was the 14th. This was in August. So Friday the 14th, I came home from work. 3 hours later, wake up with a temperature. And then a couple of days later, I'm in the emergency room. And it had so overtaken me. I couldn't take care of myself. I was just, you know, full of the virus and just didn't have any energy, any strength. And so I said all this to say this. When this overtakes you, if you have a really strong case of it like I did, your mental status is not there. You're not thinking clearly. And truly, I can look back and say, there's a lot of things that I thought, what are you thinking? Why are you thinking like this? You know, and so on and so forth. So it behooves us, when we have someone that's in the hospital, to make these phone calls and say, okay, Sally, Aunt Sally, you know, I know you're really feeling bad. Another thing you want to do, and I'm going to make some ripples here. I'm going to make some ripples in the water, so to speak. You need to call and say, I need for the tech to give Aunt Sally a good, what do I want to say, aggressive bath. Get her stimulated, you know, nice hot water, get a fresh bath, get fresh clothes on, and get that bed made. And that might seem small, but it is huge when you feel that bad. It really is. So, again, these are things that are going to help that patient not just lay there with no company, with no one coming in, and there's a huge fear. And I'm not just talking on the part of the patient. I'm talking on the part of the medical field. And I feel like this is why these protocols have just been thrown out the window, just completely forgot about. You have to check on your patients every couple of hours and make sure that they're doing these things. You have to, you know, and I do know on the first floor that I was on, it was a COVID floor, and they only had 2 patients apiece. So if they're only coming in to see Aunt Sally and one other person, you know, there's plenty of time in between to get your charting and all that done. But there's a fear. And the medical profession does not want to come down with this. Nobody does. But as nursing professionals, it's part of what we signed up for. And I hope I don't get in trouble for saying that. I'm just being very honest and candid. There is a great fear, and it's not just on the part of you as a patient. It is on the part of the medical staff. So I hope this helps somebody, because like I said, if I did not have the knowledge that I had going in as a patient of COVID, I would not have made it. I would not. But I forced myself to drink water. I forced myself to exercise. I, did all the things that I knew that I needed to do. And that is the whole reason that I am doing this. So please, when your people are in there, check on them. Check on them. And just let them know. Set your alarms on your phone for every hour so that you can get those deep breaths in. Set your phone every 2 hours for a different sound. And make sure you roll over, okay? And do a few, bringing those knees up to your chest, or, just raising them a little bit. You don't have to raise them all the way up. Just raise them a little bit, okay? So just move around. Shimmy, shake, do whatever you have to. But anyway, if this helps anybody to make it through COVID, your phone calls are going to help. You encouraging them to do these things are going to help. And we'll all praise God on the other side that we survived through COVID together. Thank you.